Clap along if you feel like a room without a roof.
Hi, everyone. Welcome to our presentation. We're going to spend the next 30 minutes with you discussing healthcare, what's happening in the marketplace, the amazing things that are happening in medical treatment today, and how in the next 5 years, we're going to see more change in healthcare than we have in the last 50 years. It's exciting. We're going to tell you exactly what we think HR needs to be thinking about when it comes to benefits programs. Benefits are second to payroll. We know they're important. We know you have a lot on your plate. So please enjoy the next 30 minutes. We're going to walk you through some of the key things happening in the marketplace and then how to make sense of them when it comes to what you want to integrate into your benefits programs. So thanks for joining us. All right, so let's get started. Today, it's all about you. We really want to make sure that you understand that we know how challenging managing benefits is today. There's a lot to keep up with, a lot going on in the marketplace, pharmacogenomics, gene therapies, high claimants, diabetics, what's driving cost, and really what do we do to incorporate some of the new technology and new tools in the marketplace into our benefits programs. So it's exciting right now. But we know that 2021 is going to be challenging for HR people to manage benefits. I think in 2020, we tried to keep everything stable and make as little change as possible. In 2021, I really feel that most HR folks managing benefits are really going to focus on where can we save costs, where can we improve care, but lower our overall spend, just from what we've been through economically as businesses. So hope you enjoyed that. We're also managing 5 different generations in the workforce, which is significant because each generation or each constituent wants a different type of benefits, is looking for different things in their benefits. And of course, the way that we communicate our benefits is slightly different by each constituent. So that's even a challenge. And just making sure that you understand what your workforce looks like generational is important. But in the following video, we're going to see right now, the man chasing the animal is the HR professional. And I hope you enjoy this clip because we are going to save the day.
Yeah.
All right, we're going to get right to unpacking our 30-minute session and really talking about technology and some of the wearables and things that we can incorporate into our benefits programs. I really look at managing benefits like managing a recipe. You have to do it step by step and methodically take it piece by piece in order to put a cohesive strategy together to manage your benefits. And of course, we want them to be look good and taste good and make the employees want to dive right into it. So we've really faced a big challenge in the last year in managing our healthcare benefits. We are facing mental health issues in the workplace, Zoom fatigue, trying to keep people present and productive at work. Statistically, when we were here last year in February, in 2020, we were talking about managing benefits in a zero unemployment world. That was actually the title of my session last year. HR was throwing everything but the kitchen sink at our employees in the benefits package because we were trying to recruit and retain our good talent through benefits. This year is quite a bit different. So we had in 2020, at the beginning of the pandemic, we saw unbelievable productivity in our workforce. As Americans, we did such a great job shifting to home offices and working remote. And the statistics showed from all the surveys that the first half of 2020, we were logging 2 to 3 hours more a day at our desks, probably because we didn't have the commute to and from the office. And at 5 o'clock, there was really no place to go. So that changed in the summer and we saw a dip in productivity. So we have additional challenges other than just managing the benefits and managing the cost. It's really managing the types of plans that we design in our programs. We have a new access to the front door of healthcare, and we're going to share a video with you right now that really does a good job at talking about how technology companies are entering in healthcare. And it's really pulling technology, wearables, and healthcare all into a bundled package. And the exciting thing is it's going to present employers with new opportunities to develop these tools and techniques into their benefits programs to increase access to care, quality of care, and lower the cost. So enjoy this video.
By the year 2030, the global healthcare budget is estimated to rise to $15 trillion. Not surprisingly, a tug-of-war for this massive market is already underway. Tech giants like Amazon, Microsoft, Apple, and Alphabet see a huge opportunity to digitize the healthcare space. They're vying with pharma titans like Pfizer, Merck, and GSK, companies with only modest experience in managing zettabytes of digital information. Whoever is best able to utilize every individual's digital health record fed by his or her data ohm will capture significant new profit pools and disrupt existing ones. Apple has already made a foray into digital devices like the massively popular Apple Watch, which now can accommodate ECG capabilities and detect atrial fibrillation. As Apple CEO Tim Cook recently stated, Apple's greatest contribution to mankind will, ultimately, be about health. Microsoft has moved into biopharma tech by investing in wet labs, and in collaboration with DNA Nexus, has launched a set of cloud-based tools for genomic research. In 2019, Google acquired Fitbit for $2.1 billion, positioning itself for monetizing the last inch, and has invested in more than 30 biotech ventures in diverse therapeutic areas. As for Amazon, it disrupted the pharma supply chain by purchasing PillPack for $753 million and has invested in Haven, a joint venture formed to tackle rising healthcare costs. Perhaps Stuart Varney put it best: the tech giants are extending their tentacles because they have the money to do so. And clearly, they do. The top 6 tech companies have $509 billion in cash, while the top 20 biopharma companies have only $199 billion in cash. It might not be long before we're seeing Dr. Apple for our next physical.
So you can see how tech companies are really making an inroad in healthcare right now, and it's because that's where all the money is. So the digitalization of healthcare is here, and as employers managing benefits, we have to embrace the new opportunities. And if you think about the technology and the changes that we're seeing in technology, look at the smart device. We don't leave home without our smartphones. And that's really how healthcare is going to be integrated with most clinical, chronic illness and disease management programs in the future. We have our smart devices with us. They let us answer the telephone. They let us play music. They can be an EKG. The Apple Watch is an EKG that connects with your smart device. And when it's seeing that there's an adverse event, it can actually send an alert to not only the member, but their physician. We're seeing that in a lot of different areas. Change is definitely here to stay. And artificial intelligence is also making a foray with the tech companies into healthcare, giving us unique opportunities to decide paths of treatment based on who's doing what with the best success rate at the lowest price. So artificial intelligence is gathering all the data that used to be very sporadic and hard for our members to find when they were seeking care. Look at diabetics. It's the second cost driver for most employers. Diabetes has comorbidities. There's lots of different ways that a diabetic now can monitor their diabetes and monitor their glucose. This is a contact lens with a microcontroller. Most diabetics wear glasses or contact lenses. This measures your glucose level and sends an alert to your smart device, and also can send an alert to your healthcare provider in the event of an adverse glucose reaction. This is one of my favorites. Rochester Institute of Technology has developed a new toilet. It's a smart toilet. It also communicates with your smart device and potentially your provider. But just think what this could do for somebody suffering with congestive heart failure, which is usually number one or number two on the list. So the top three cost drivers with most employers is cancer, heart disease, and diabetes. This is a smart toilet that measures your oxygenation level, your blood pressure. It does a urinalysis, and it sends all of that information within minutes to the patient's provider. So imagine before we had non-compliant people that weren't taking their blood pressure in the morning, that weren't calling into their doctor, but we were spending lots of money on disease management. Now for $2,000 to $3,000, we can take somebody that's a high risk for becoming a high claimant and give them the tools necessary to monitor their health without any effort at all on their behalf. And of course, we're going to move right into pharmacy now. So this is one of my favorite topics. It's one of the top cost drivers for employers. Right now, it's 50 cents on every dollar you spend. So if you look at your medical and your pharmacy expenses, pharmacy right now is about 50% of your spend. In 2021 and 2022, we're going to see that escalate significantly with the new genomic treatments and the new medical advancements in pharmacy. We have over 50 drugs in the FDA pipeline for approval in 2021 and 2022 that are over $1 million therapies. So it's something that HR professionals managing benefits have to be aware of and up on. These new pharmacogenomics, and we're going to explain what those are in a moment, are usually very, very expensive. They're usually injectables. We've decoded the human genome, and now we have medicines that actually can look at your human genome and understand how pharmaceuticals will impact you as an individual. So we've moved from chemical flat pills to precision medicine, where medicine is going to be developed for an individual based on their genomic makeup. So we're going to play a quick little video for you after the Star Trek video. It's high tech, high touch, and it's here to stay. So it reminds me of Star Trek because I think of this as just unbelievable that they're able to understand the human genome and then make drugs specifically for that particular person. So you're going to see two more clips. The first one is just talking about precision medicine and understanding that now they can do a mouth swab and understand your genetic makeup and how you metabolize medicine and give you the correct dose and the correct medicine, the correct dose at the correct time. And that's really something that we've never been able to do before. So I'll give you an example. There is a breast cancer medication that 3 out of the 5 women that get the medicine can metabolize it, and 2 don't have the correct enzyme to break down the drug and make it effective. So can you imagine taking a $4,000 a month medication and going through all of the side effects and not having it work because you don't have the correct enzyme to break down the drug and make it effective? So now this mouth swab prior to getting some of these really expensive drugs is being done to ensure that the person, it's the correct medicine for the person and that they're able to use it. It's going to make the medicine more effective. The outcome for the member will be much better health. And of course, it will be less expensive for the employer. The second video clip that we're going to talk about is taking that a step further. And what you're seeing with the genomic treatments right now that are millions of dollars is where scientists are actually able to understand the incorrect lettering in our genome and go in and correct it. And we're not trying to make HR folks that manage benefits pharmacists or doctors. But the reason that we all have to understand this is because these are the next drugs that are coming to market. So this is what you're going to see in your utilization, and this is what's going to hit your bottom line. So there's over 50 of these genome treatments that are in the FDA pipeline for the next 2 years, and they're going to cost millions. So it's the next tsunami of cost, and we need to be aware of what they are and what they do. And then we have to figure out how to pay for them. So I think the next minute or two with these two next clips, it's really important to understand what's coming so that we know what we're dealing with and how we're going to put clinical programs in to ensure that we maintain affordability of the healthcare plans.
Come with us to a new world, deeper than the ocean, as unfathomable as the universe. A world that doesn't exist outside you, but within you. Where breakthrough science is replacing chemotherapy with immunotherapy. Where we can now attack the causes of disease, not just the symptoms. Where medicines once produced for all are now designed to fit you. Today, 140,000 biopharmaceutical researchers go boldly to discover treatments and cures unimaginable 10 years ago and are on the verge of more tomorrow.
To understand CRISPR gene editing, let's start with what is DNA? Handed down from generation to generation, every cell in your body carries a copy of your genetic code called your genome. It's made up of DNA. It's like a book that describes you, a book made up of 3 billion letters arranged in different sequences that make up DNA words. These words can influence the traits that you take on: athletic, intelligent, gifted. Recently, computers have deciphered the entire human genome and have identified genetic mutations behind diseases that currently have no cure. With CRISPR, we can edit DNA. CRISPR is a man-made molecule that can be programmed to find mutated or diseased DNA. It's also equipped with a pair of molecular scissors. So once CRISPR finds its target DNA, it can snip that section from the genome. Sometimes the body can repair itself. Other times, scientists can patch it with corrected letters. If this happens in egg, sperm, or embryonic cells, the changes will be permanent and passed on to future generations. CRISPR is already showing promise. It's being used to cut out the HIV virus, eliminate Huntington's disease from the brain, and even alter a mosquito's genome so it's less likely to spread malaria and Zika. CRISPR could lead to a new world of treatments, curing diseases and even eliminating them, so future generations won't ever have to suffer from them again.
So that's really cool new information, right? The gene therapies and the pharmacogenomics that all will allow us to understand and develop medicine for each individual based on their human genome versus the chemical flat pills of years ago. So we are seeing a lot of change. One of the other items that I like to mention, because employers have an opportunity to develop centers of excellence programs for their top driving cost. Cancer is one of the top driving costs. Jim Allison, pictured here, is a physician at MD Anderson in Texas. And he was actually the person who developed and created immunotherapy, which is trying to understand why our body, our own immune system, can't fight cancer cells. So he has a new technology where he's unmasking those cells to our own human immune system and tackling cancer in a different way. This technology is being used at MD Anderson, Sloan Kettering, the Cleveland Clinic, and other centers of excellence. And it does give employers an opportunity to develop a center of excellence to target this high cost driver in our healthcare plans. Cancer is always number one or number two on the high claimant list. So thankful to Jim for developing that technology. And I know we've just unpacked a lot, but we really should be very happy because these new technologies are going to cure things. All we have to do is figure out how to integrate some of this technology into our healthcare plans to make sure that they stay affordable. And it really is just taking it step by step. Back to the recipe, it's hard to think of Thanksgiving dinner when you're thinking of the 15 things that need to go on the plate. But it really is a lot easier if you just focus on one thing at a time and take it step by step. So step one in our mind is really data analysis and acquisition. You're really looking at last year's data, determining what the cost drivers are, and then coming up with solutions. And you can't really create a solution to a problem unless you identify what the problem is. So pick your partners very carefully. You're buying with your consulting partner knowledge and know-how, really understanding what the data is and what the key opportunities are in the marketplace to put into your programs to keep things affordable. Step two is really developing the strategy, right? So once you understand the data and the problems, you're really in the development of the strategy. What are the things that you're going to look at, looking at the costs? And this is really Q1. So for those of us, as we're sitting in February, we really need to be next month in March asking our carrier partners for the utilization data from 2020, really looking at that data, looking at the high claimants, looking at your pharmacy data, looking at your disease categories, and really developing a strategy in April of what you're going to go out to bid and look at in the marketplace as solutions to those things in May and June. And then, of course, in July and August, you're making decisions on your new plan designs coming up for 2022. In August, you're going to your executive committee with your presentation of findings, saying, here's the problems that we're trying to solve for. Here's the solutions we vetted in the marketplace. In the RFP process, here's what we came up with: performance metrics, performance guarantees, and pricing for those. And then really in August, making decisions on what you're putting in your plan for next year, saving September and October to develop communications materials. So that really is how we develop our plan of action. We need to get started this month and next month in order to create every opportunity for the plans. And, we are really deploying our strategies. We do these educational videos every month. It's Take 5 with MB, that's me. And you can log on and find me at mbhealthcare.com for our next session and sign up. So we hope to see you again. There's my contact information if anybody wants to contact me and get more information on our consulting practice. And I'll leave you with this.
You're still here? It's over. Go home. Go.